Fungi are everywhere in our world, taking advantage of warm, moist environments to grow and prosper. It's no different on our bodies.
It's always a battle between the body's immune system and what it can do versus the organism. And so if for some reason there's just more organism than what the body can handle, it can be pretty widespread.
Oh, that's all dark and green.
Babies, due to their immature immune systems, are often at risk. The moist environment of the diaper is particularly attractive to the yeast fungus.
If you've tried to treat it with a barrier cream and it's not getting better, or it's lasting for more than 2 to 3 days, or if it's really angry looking and it's in the creases of your child's legs and private area, those are reasons that you might think it's yeast as opposed to something else.
When yeast attacks baby's mouth, it's called thrush. Look for small white patches that don't easily wipe off. It's most common while mom is breastfeeding.
It's really important that if your baby has thrush that you treat it, but also you want to treat yourself as well.
Yeast also loves skin folds.
Where you have skin touching skin and it gets wet there, usually from sweat, that's where the yeast likes to set up shop. Diabetics tend to be predisposed just because they're just enough immunocompromised, and a lot of diabetics are also overweight, and so they have folds in their skin that trap moisture, and that's just what the yeast loves, is that moist environment.
Another common fungal skin infection is called tinea versicolor.
It's called versicolor because it can come in many different kinds of colors, and it takes on this very spotty sort of appearance, kind of like a Jackson Pollock type of painting where you might be splattering paint. It's incredibly easy to kill, but it's incredibly easy to get it again just because it does like particular skin types.
Athlete's foot and other areas affected by ringworm tend to create the most havoc, probably because we offer ringworms so many opportunities to spread. Swimming pools, locker rooms, and other communal areas can be hotbeds for picking up a fungal skin infection. Pets can also be carriers.
Definitely pets can give people ringworm, and so if they're starting to scratch more in a particular area, I would just definitely, look at their skin and see whether or not they're developing their own ringworm, and the vets, have ways of treating them.
While most fungal skin infections can be frustratingly frequent if you're susceptible, they aren't usually life-threatening. But if you're immune compromised and garden, farm, or live in certain geographical areas of the U.S., there is danger.
There are a lot of bad actors in terms of fungus or fungi, and those can be very deep into the skin. They can even invade into the bloodstream. They can be in your lungs. And people who have intact immune systems, their body can take care of it. That's not a problem. But if your immune system is compromised, then these types of fungal organisms can really set up shop and take root in the body.